Hi everybody. Today we're going to discuss one of the important bones in the axial skeleton, which is the vertebral column. So we're going to look at the vertebral column, and associated with vertebral column we're going to look at the ribs and the sternum. Okay, as you can see, this is the vertebral column, and primarily it's composed of vertebra. And this vertebral column and is also referred to as the backbone, or we can call it as a spine. And at the, normally in adults, on the back of the body, you see a furrow, all right, indentation, all the way from the neck, the root of the neck, and then go all the way down to the coccyx. At the back, you will see a furrow. And you would see, and you can feel a bony protrusion when you feel it with your fingers. And basically, these are the bony protrusions of the vertebral canal, or the vertebral column, the bones of the vertebral column, which are the vertebra, the spine's processes. Okay, so the vertebral column, or the vertebrae, are segmentally arranged. So we have we have a cervical region composed of the cervical vertebra. We have a thoracic region composed of thoracic vertebra. We have the lumbar and lumbar vertebra, and then we have the sacrum, the coccyx. Okay, so we have. So let's look. So basically, the vertebral column vertebra is primarily the function of it is to bear the weight and transmits this weight to the lower extremity, all right? And it's movable, all right? And it's movable like, let's look at the numbers of it. Let's look at this model here. So we have the cervical vertebra, we have the thoracic, lumbar, and sacral vertebra. So we have 7 cervical in the upper part. This is in the neck region. We have the 7 cervical vertebra, and then we have 12 thoracic vertebra. This area here is the thoracic part, 12 thoracic, and then we have 5 lumbar, and then we have the sacrum. Okay, we have the vertebra that makes up the sacrum, and then we have the coccyx, what we call as a tailbone. So we have 7 cervical vertebra, 12 thoracic, 5 lumbar, 5 sacral, okay, fused. These the vertebrae that makes up the sacrum are fused, and the bones that make up the coccyx are also fused. So there's 5 vertebrae that makes up that makes up the sacrum, and there are either 3 or 5 coccygeal bones, but we say that there are 4 coccygeal bones that make up the coccyx. So there's 7, 12, 5, 5, and 4, and that makes up 33. So the total amount of vertebra in the vertebral column is 33. So we call this, so we name this according to their level, their segmentation. Like in cervical vertebra, we say that with the level of to distinguish these vertebrae, we call them according to their numbers, like C1, C2, C3. So C1 is the first cervical vertebra, and C7 is the 7th cervical vertebra. T1 is the first thoracal vertebra. T12 is the 12th thoracic vertebra, and so on. So all these, until the end of the lumbar vertebrae, these are movable. Okay, so, and in between these vertebrae, as you can see, there's intervertebral discs, all right? And this intervertebral disc is basically cartilaginous or fibrocartilage structure, and it is composed of 2 structures. The outer part is annulus fibrosus, it's made out of annulus fibrosus. Then the center part is produced by or formed by the nucleus pulposus, and basically nucleus pulposus is a remnant of notochord in embryonic development. So going back, so we have So these are movable, and they are separate all the way down to at the level below the fifth lumbar vertebra. So all these are movable, and there are 24. So there's 7, 12, and 5, totally 24. These are all movable. Now the next 9, which is the 5 vertebrae that makes up the sacrum, they're fused. So the sacral vertebrae, they fuse, they form the sacrum, all right? And the coccygeal vertebrae also, they are also fused, and they form the coccyx, or the tailbone. And like I said, there are usually 3 or 5, and average in adults there are 4. So there's 5, 4, there's 9 fused vertebrae at the lower part of the vertebral column. All right, and what we see here, again, one of the important things that we see is if I show this vertebral column laterally, you can see the curvatures that are present. There are 2 curvatures. There's primary curvature and secondary curvatures. Primary curvature is basically are found in the embryo. It's like a fetal position, and it's like C-shaped. All right, so this is. And this is prominent, and we see this C-shaped or fetal positioned curvature are primary curvatures, and we see that at the thoracic level. So this here again, it's concave anteriorly, okay, at the thoracic level, and then we have again concave anteriorly at the sacral level. So thoracic level and sacral level are the primary curvatures. However, and after birth, okay, so they have the formation of the secondary curvature, which is present at the cervical and the lumbar level. At cervical level, it forms like after 3 to 5 months, when the baby or the infant starts to hold its head in an upright position, and that's how you have this bent formation. All right, this cervical curvature. And after like 1 year, the infant starts to walk, okay, and starts to hold the body in an upright position, and so you have the formation of the lumbar curvature, and this is also referred to as the secondary curvature. Then this lumbar curvature begins like at 18 to 24 months. So that's part of the secondary curvature, which occurs later on after life. However, the primary curvatures, which is the thoracic and the sacral, are present during the embryonic development. So basically, these are the curvatures of the vertebral column. Okay, so a couple of minutes later, we're going to look at the individual vertebrae and all the unique features that we need to know in the cervical vertebra, thoracic, and lumbar, which is and also we need to know the atypical, unusual features that these bony components contain to identify or distinguish from one another. And after going through the vertebrae, after finishing the vertebrae, we're going to look at the ribs and the sternum. As you can see, the rib cage is composed of basically the rib sternum on the anterolateral aspect of the rib cage, and then at the posterior aspect we see the vertebral column. Okay, if we look at the ribs, okay, and we see that there's 12 ribs on either side, all right? So there's 12 ribs on the left side and 12 ribs on the right side, so totally there's 24, obviously. All right, so we have 12, we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and this is 11, and this is the 12th rib. As you can see, all these ribs are articulated on the posterior aspect with the vertebrae, forming the vertebral costal vertebral junction. Costal vertebral junction at the posterior side. On the anterior side, it has it unites with this costal cartilage, what we call as costal cartilages, and this costal cartilages basically unites with the sternum on the anterior aspect. And we divide the rib cage. Well, before that, so basically the rib cage is important in maintaining and protecting the internal thoracic cavity structures, which are primarily the heart and the lungs and the primary vasculature, blood vessels that are located here. So basically it protects this particular area, and this is really important. And second important function of this rib cage and the ribs is that since it's movable, it is important in increasing the anterior posterior volume of the thoracic cavity, thus facilitates or increases the respiratory motion, either inspiration or expiration. Breathing in or breathing out is also accomplished by the movement of the ribs, which is really important. So there are, like I said, there are 12 ribs. Okay, so there's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. Now, first 7 ribs are regarded as true ribs, and the rest are regarded as false ribs. And there's also last 2 ribs are also referred to as the floating ribs. So the reason why they call this true rib is that each individual rib, they have their own costal cartilages, and these costal cartilages independently attach or articulate with the sternum. Okay, independently. So let's count 1, 2, 3, 4, 5, 6, 7. So these 7 ribs, the first 7 ribs are true ribs. As you can see, they have their own costal cartilages, and they have their own attachment points on the sternum. Okay, so that's why these are regarded as true ribs. However, if we look at 1, 2, 3, 4, 5, 6, 7. So starting from 8, 9, 10, they had costal cartilages, but they don't independently unite with the sternum. So basically, they unite with each other, and they attach to the above costal cartilage, which is the 7th costal cartilage, and then they attach to the sternum. So they don't have any independent or separate attachment point for the sternum. That's why they call it as the false ribs. Now, the last 2 ribs, 11 and 12, does not attach to the sternum on the anterior, and they don't have the costal cartilages on the anterior side. And basically, it's free on the anterior side of these last 2 ribs. So that's why they call these 2 ribs as the floating ribs. So 11th rib and the 12th rib is referred as floating ribs. Okay, so we're going to look at the independent areas of the ribs once again. Before that, just let me show you in this model what we see here. Okay, so we looked at the curvatures, right? We looked at the intervertebral discs here. One other thing that we need to look at is these yellow structures that emerge out from this vertebral column. So one of the important functions that I need to also express is that vertebral column houses one of the important structures or nervous system, central nervous system structure, which is the spinal cord. So there's a spinal canal inside this vertebral column. We're going to look at that, how it's formed. So you have the spinal cord going in through the spinal canal, all right, or vertebral canal, going through the vertebral canal, and from this from the spinal cord, you have these spinal nerves coming out from each segment, from each level. So you have C1, C2, C3 spinal nerves, L1, L2, L3 spinal nerves coming out. Where do they come out? As you can see, these are spinal nerves. They come out from the intravertebral foramens. And we're going to look at, when we examine the vertebra separately, we're going to look at how these intervertebral foramens are formed. But basically, these intervertebral foramens, as you can see, they emerge from the lateral side of the vertebral column. So basically, this part here is the anterior aspect of the vertebral column. This part here is the posterior aspect of the vertebral column. Okay, so as you can see, so this here is the anterior aspect of the vertebral column. Here is the posterior aspect. So basically, we're going to look at that in a bit later, but this is the bodies of the vertebrae. Okay, so these are the bodies of the vertebra, and the protrusion part of the vertebra is located on the posterior side, on the back. So this is the spinous process of the vertebra, and this is the body of the vertebra. So the body of the vertebra is on the anterior aspect. However, the spinous process of the vertebra is located on the posterior aspect. And you can feel your spinous process on your lumbar side and on the cervical and thoracic segmental level. You can feel the spinous process at the back of your body. Okay, so that's about it. So what I'm going to do now is to look at we're going to look at the vertebrae independently one by one and see the differences and see the important distinguishing features of each individual vertebra. Okay, let's get started. Okay, what we see here, I just put 5 bones here, and these are representative bones, all right? And basically this bone here represents the cervical vertebra, this represents the thoracic vertebra, okay? And this represents the lumbar vertebra. Now, and by the way, these two represents the cervical vertebra, C1 and C2. All right, okay, so these are basically different atypical vertebra, and we're going to look at that independently. So, so as you can see, there are distinguishing features in cervical, in thoracic, in lumbar vertebra, and there's are undistinguishable, atypical features that is important to us to know in order to distinguish that particular vertebra. For instance, if I put this and say that what is this, and put this in the exam, in the exam. What level, I might ask, what level of this vertebra? Then you have to say it's cervical vertebra. You don't have to say it's like what, C7 or C3, but it's just like this is cervical vertebra. You need to identify this as thoracic vertebra, and this as the lumbar vertebra. Okay, and these are the atypical cervical vertebrae. We're going to look at that independently. Okay, so as you can see. Let's look at the general features of a vertebra. What we see here in general features of the vertebra is this. Let's look at. So this is basically a thoracic vertebra. All right. So we're going to look at the atypical parts of each segment, but we need to learn what are the general features of a basic vertebra. So the thing that we see here in the basic vertebra is first the body. So this is the body of the vertebra, okay? So this is a thick, flat part, and this is the anterior part of the vertebra, and so this is the body, okay? So basically the body is the area that carries the weight. And in between the bodies, we have the intervertebral disc. So we have another thoracic vertebra here. Okay, so this is how it articulates. So in between the two bodies, okay, so this is the body of the let's say this is the lower vertebra. Let's say this is T2 and this is T1. So between T1 and T2 vertebra, we have the intervertebral disc located here, fibrocartilaginous articulated disc between the bodies. So basically, the body contains or houses the intervertebral discs. All right. So this is the body, and on the posterior aspect, this is the anterior aspect. So then this is the posterior aspect. The posterior aspect basically is composed of vertebral arch. So this whole thing is called the vertebral arch, and vertebral arch is formed by pedicles and lamina. This on each side here. Okay, this is called the pedicle. Pedicle is referred to as the small leg. Okay, this is the pedicle here on either side that comes out from the body, and the pedicles basically here unites what we call here as the laminae. So on either side they have left part lamina on the left part, and then we have the right lamina. So basically, we have lamina has two parts, the left part and the right part of the lamina, and these two laminas unite and they form this what we call the spinous process. So we have So we have the vertebral arch is composed of pedicles, and 2 pedicles and 2 laminae. All right, and so this is the vertebral arch. The other thing that is common for the for all vertebrates. Okay, so we have the body, then we have the vertebral arch, we have pedicles, laminae, and then we have processes. What processes do we have? One, we have the spinous process that's protrusion in the posterior aspect. This is the spinous process, and the number of spinous processes, as you can see, is 1. And then we have transverse process. Transverse process, as you can see, slants towards the lateral side. All right. These are the transverse processes. Transverse processes, there are 2, one on the right and one on the left. All right. 2 transverse processes, 1 spinous process. And then we have the articular process. So we have the superior articular process here, and then we have the inferior articular processes here. Now, these processes have articular facets or articular surfaces, which is here. So we have 2 articular surfaces in these processes, and then we have 2 articular processes, or 2 inferior articular facets or articular surfaces on the lower part. So what does these articular facets or processes do is that they articulate with the above and lower articular surfaces. So this is the above thoracic vertebra, let's say, okay? So this is how it articulates. So basically what happens is that the superior articular facets or superior articular surfaces articulates with the inferior articular surfaces of the above vertebra. All right? It articulates like so. And so on. If I get another vertebra, so the superior so we're talking about this vertebra here. So we have the superior articular facets articulate with the inferior articular facets of the above vertebra. So this is the inferior articular facets. All right, so it articulates with the inferior articular facets of this vertebra articulates with the superior articular facets of the lower vertebra, lower vertebra, superior articular facets. So this is how they articulate. Okay, so superior articulates with the inferior. Okay, superior articulates with the inferior of the above. All right, so that's simple. Good. Now, what happens? So we have, like I said, we have what do we have? We have transverse processes, we have spinal processes. We have the superior articular process that contain superior articular facet, and then we have the inferior articular process that contain the inferior articular facet. So simple, right? Okay, good. Now, when these vertebrae unite with each other, as you can see here, okay. Now, if from each vertebra, if we look at each vertebra. So we have this notch here. So you have the superior vertebral notch, and then we have the inferior vertebral notch. So these are indentation of bone. All right. So we have superior. It's not prominent, but here in the inferior part, it is really prominent. The notch or depression, or the opening of this area. So what happens is that when this unites. Okay. So what unites? So we have the union of what? We have the union again with the superior vertebral notch and the inferior vertebral notch. So we have the union of superior vertebral notch of the lower vertebra with the inferior vertebral notch of the above vertebra. As you can see, they two unite and they form what we call as the intervertebral foramen. So this is the intervertebral foramen. So what's the importance of like I showed you 5 minutes ago in the model, the yellow structure that comes out, that exits on the lateral side of the vertebral column, these were the spinal nerves. So basically, the spinal nerves comes out through this foramen, and this is called what? Intervertebral foramen. And intervertebral foramen is formed how? It's formed via the completion or the union of the superior vertebral notch of one vertebra and the inferior vertebral notch of the above vertebra. They unite and they form a foramen. And they form a hole where the spinal nerves exit through that foramen. Okay, so that's the intervertebral foramen. and this is basically a common feature of a vertebra. So these are basically common features of the vertebra. All right. So we have the body, we have two pedicles, two laminae, we have the spinous process at the back, and on the lateral side we have the transverse processes, and then we have the intervertebral foramen on either side, on the lateral side aspect, and last we have the vertebral foramen. So vertebral foramen basically is a hole or the opening between the vertebral arch and the body. So this is the vertebral arch, and this is the body. Okay, so in between, so you have the opening, what we call as the vertebral foramen. So this is the, don't get confused, this is the vertebral foramen. On the lateral side is the intervertebral foramen. So intervertebral foramen is an exit for spinal nerves. Vertebral foramen, all the vertebral foramen from the vertebra, they come together, okay? All these vertebral foramen come together. As you can see, they form a canal, what we call as vertebral canal here, all right? So this is the vertebral canal, and through this vertebral canal is the spinal cord is located in this canal, all right? So this is the vertebral foramen in each vertebra. So basically these are common features that we see in all vertebrae. So what's the uncommon part, or the atypical part of each vertebra? So atypical part of each vertebra is that, as you can see, so we see the body. Okay, let's look at the body. So this is the cervical vertebra. Now let's look at the three. Okay, this is the cervical vertebra. Okay, let's look at all these three. Let's compare this all these three vertebrae. So this is part of the segments. So this is the cervical vertebra, this is the thoracic vertebra, and this is the lumbar vertebra. Okay, so if we compare these three segments, so so the body here in the cervical vertebra, it's not that big. Okay, so as it goes down towards lumbar, it gets thick, as you can see. So the body in thoracic, it's bigger than the cervical. However, in the lumbar cervical vertebra, the body is really thick. Why? Because it's the weight is increased in the lower part of the vertebral column, and it bears a whole lot of weight at that particular area. That's why. So so the body is different. The second, in the cervical vertebra, as you can see, the spinous process is horizontal. Okay, it's basically facing backwards, straight, horizontally. And that's one. The second important distinguishing features, or the other important different characteristic, is that it's bifid. Okay, so you have two branching parts of the spinal process. However, in the thoracic level, the spinal process is only one. There's no bifid, and in the lumbar, the spinal process is not bifid. Okay, so it's bifid in the cervical vertebra, except there's exceptions, of course, except C1 and C7. C1, we're going to look at that. It's not bifid. It doesn't have any spinous process in C1, and in C7, the what we call as the vertebral prominence, we don't have a bifid there. So there's exceptions, but primarily there's bifid in the spinous process. All right, it's bifid, except C1 and C7. Don't forget that. And one of the other important things about the spinous process in the thoracic region, as you can see, it slants inferiorly. Okay, it moves, it points towards downwards, in a downward direction. However, as you can see, the spinous process in the cervical region, it's backwards horizontally, and also it's horizontal in the lumbar vertebra. So it's horizontal in cervical and lumbar vertebra, the spinous process. We're talking about the spinous process. However, in thoracic level, it slants downwards. Okay, it points or in a downward direction. That's one. Another important characteristic is that the superior articular process, as you can see, and then you have the superior articular facet. In the thoracic and in the cervical region, it's facing backwards. All right. However, in the lumbar region, as you can see, the superior articular facets, they're facing towards each other. That's another important difference. All right. And the other the difference is that the vertebral foramen, vertebral foramen in the cervical region, it's triangular. As you can see, it's triangular. And in the lumbar region, it's also triangular. All right, as you can see. So the vertebral foramen in the cervical and in lumbar vertebra, it's triangular. However, the vertebral foramen in the thoracic region, it's circular. As you can see, it's circular. All right, that's another important characteristics. Okay, another important characteristic is that in the cervical vertebra, you have this in the transverse process. In the transverse process, you remember this was the transverse process. These on either side. Here in the cervical vertebra, basically this is the transverse process. Inside the transverse process, you have this foramen, and this is called the transverse foramen. Transverse foramen are located in the transverse process of the cervical vertebra. So this is another important characteristics that differentiates cervical vertebra from thoracic and lumbar. So in the transverse process, in the cervical vertebra, we have a transverse foramen. Okay, and through this transverse foramen, we have an important artery, the internal carotid artery, the internal carotid vein, and sympathetic plexus passes through these foramen. Internal carotid artery, internal carotid vein. Vertebral artery, vertebral vein, and sympathetic plexus. Vertebral artery, vertebral vein, and sympathetic plexus passes through these intervertebral foramen. So this is a characteristic feature for the cervical vertebra. Okay, another important differences among each other is in the thoracic vertebra. Why? Because in thoracic vertebra in the body, on the lateral sides of the body, we have facets, and either whole facet or demifacet. Okay, so this is two demifacets. On the top we have the upper demifacet, and then we have the lower demifacet. That's one. And second, and also we have a facet on the lateral process. So this is the lateral process of the transverse process of the vertebra, transverse process of the vertebra, and then we have the articular facet, or what we call as the costal articular facets, where the ribs attach to these areas. Remember, we had 12 ribs, and the first the 12 ribs basically attach to the thoracic vertebra. Okay, so how do they attach? Basically, they attach like so. Let me show you. So this is the rib. So basically, what happens is, so if this is the rib, right? So basically, rib attaches to the thoracic vertebra like so. Like so. All right. So we're going to look at the ribs, and the ribs also have the articular surfaces, and these articular surfaces basically attach. Part of it attaches to the lower articular demifacet on one vertebra, and part of it attaches to the another demifacet on the above vertebra. So we have two demifacets. So demifacets on this vertebra here, and then we have another demifacets on this vertebra here. And basically, so these two demifacets forms a whole facet, all right? Whole facet, and basically, and the head of the rib attaches to these areas, all right? And there's also another attachment point of the rib that attaches on the costal surface of the transverse process. So this is the transverse process. This is the costal surface. So part of the tubercle of the rib again attaches to to this costal surface of the transverse process. So we have three basic attachment points. We have the demifacets of one vertebra, and then we have demifacets of the lower vertebra, and then we have the whole facet, the costal facet of the transverse process. So all these three areas are attached to the ribs. So basically, in the costal vertebra, we have these costal attachment facets, while we don't see these costal attachment facets in the lumbar, nor we see them in the cervical. Why? Because the ribs, the 12 ribs, only attaches to the 12 thoracic vertebra. The only difference is that the first thoracic vertebra, they have one whole facet rather than two demifacets. That's one important difference. And in the last two thoracic vertebra, the 11th and the 12th thoracic vertebra, and they also have one whole facet rather than two demifacets. So the common typical vertebra of thoracic level of thoracic vertebra, they have two demifacets. However, the first thoracic and 11th and 12th thoracic vertebra, they have one whole facet rather than two demifacets. And we're going to look at that when we look at the ribs. Okay, so this is the thoracic vertebra, right? And one other typical thing of the lumbar vertebra, like as this is the body. Again, we have the pedicles, and then we have the lamina. Okay, this is the arch, the vertebral arch. We have the transverse processes. We have the superior articular process. You have the inferior articular process, superior articular facet, inferior articular facet. All right. One other thing in that only is contained in the lumbar vertebra is the mammillary process and the accessory process. So at the back here, so this part here, I don't know if you can see it, but it's not really obvious here. But so this part, the protrusion part, is the mammillary process, and this part here, which is located in the lamina, this is the accessory process. Well, these two bony protrusions, basically, they are the site of attachment for certain ligaments, and this is unique to the lumbar vertebra. So the uniqueness is the mammillary process, the accessory process. That's one. That's one. Second, the body of the vertebra is really thick. That's second, and then the superior articular facets are facing towards each other. However, in the thoracic, they were facing backwards, and again in the cervical, they're also facing backwards. In terms of spinous process, it's thick, triangular shape. It's short, and it's facing horizontally. Here in thoracic, the spinous process on the thoracic level, thoracic vertebra, okay, it's facing inferiorly. It's big, and it's facing inferiorly, and it's especially, it's facing inferiorly. And in the cervical level, it's horizontal, and it's not short, or it's quite long, and it's facing horizontally. All right, and the only different features of the cervical C7 is a vertebral prominence, which is it has a large, long spinous process, and basically you can feel from outside. Okay, you can feel this spinous process when you palpate it with your fingers. The vertebral prominence, the spinous process of vertebral prominence. So these are the distinguishing features of the typical and atypical vertebrae. So let's put them aside, and let's look at the first and second vertebra, which is really unique. They have unique features. Okay, so this is the first cervical vertebra, and this is called the atlas. All right, this is called the atlas, and this is the second cervical vertebra, and it's called the axis. So what we say here, this is C1 and this is C2. Atlas, axis. All right, C1 and C2, atlas, axis. Let's look at them one by one. In that atlas, it has so this is the atypical vertebra. Therefore, they have different features from the other vertebrates. One, they have the anterior arch and posterior arch. This is the anterior arch. This is the posterior arch. As you can see, there's no body. Okay, there's no body. All right. There is this vertebral foramen, and this vertebral foramen on the anterior side, it's quite restricted. However, on the posterior side, it's a little bit big. So on the posterior side, you have the spinal cord, and on the anterior side here, so you have the another bony protrusion of the spike of the second vertebra that comes out and attaches to this area, fills this foramen here on the anterior side, and this is called the odontoid process, or the Dent's axis. So this is the second cervical vertebra. This pointy, bony part basically goes through this anterior opening of the foramen. So this is how it articulates. So this is the Dent's axis, or it's just basically referred to as dents, or odontoid process. It's like tooth-shaped structure, and this is the C2, and that's how it comes and fills this anterior portion of the vertebral foramen. And what else do we have? So we have the anterior arch, posterior arch, and then we have the lateral mass. Okay, so this is called is lateral mass, this area here. And we have again the foramen. Okay, we have the transverse foramen. Again, vertebral artery and vein, and the sympathetic plexus passes through the vertebral foramen. And the vertebral artery, after it passes through from the sixth cervical vertebra. Okay, it starts from the sixth, and then goes all the way up to 5, 4, 3, 2, 1. And after it comes out through the first cervical vertebra, the atlas, it comes out, and then curves around this area here, and then goes up through the foramen magnum and enters the brain of the skull. So this area here is called the vertebral groove. So it comes out and then curves around through this vertebral groove, and then goes in through the foramen magnum and into the skull. So this part here is called the vertebral groove. On either side, it's called the vertebral groove. On the anterior arch and the posterior arch, we have the anterior tubercle and posterior tubercle. Okay, and then we have the superior articular facets, and then we have the inferior articular facets. All right. So superior articular facet here articulates with the condyles of the occipital bone. So what happens is we have this the skull. Okay, so we have the superior articular facets, all right, here on either side. So superior articular facet basically unites with the condyles of the occipital bone. As you can see, these are the condyles of the occipital bone. So basically, they articulate with the condyles of the occipital bone, as like so. Okay. So basically, they form the atlanto-occipital joint. So atlanto, atlas, and the occipital bone. So we have the atlanto-occipital joint. And basically, atlanto-occipital joint, you have this motion here with nodding, and basically it's like, you know, a yes motion. So it does this motion here. Okay, it's a nodding, anterior posterior nodding. So this is the atlanto-occipital joint. And so this is the above joint. So in the lower joint, we have the inferior articular facet unites or articulates with the superior articular facet of the C2, like so. All right. I'm sorry, like so. So inferior articular facet unites with the superior articular facet of C2. That's one union. And the second is that this odontoid process of the C2 articulates with the fovea of the anterior arch here on the internal aspect of the anterior arch. So you have this articulation here again, and this articulation here is the atlantoaxial joint. Okay, between the atlas and the axis, and you have this circular motion here, doing a no motion. Okay, rotating the head around either side. So this rotational movement is accomplished between the articulation between the atlas and the axis. All right. So this is the atlas, all right, and on the transverse process we have the anterior posterior tubercle. You don't see it So you have the anterior tubercle, posterior tubercle of this transverse process. Okay, so the reason why they call this atlas, as you know, I would mention this in the classroom too, is that this atlas, according to the Greek mythology, is that the atlas carries the whole world on his shoulder. So basically, the atlas carries, it appears to carry the whole cranium or the skull on top of it. That's why they call this as atlas. Okay, this is C1. C2 is like this. All right, C2. It appears to be irregular, but it is regarded as irregular. The reason why is that it has this body here. So this body on the anterior aspect or the superior aspect, you have this bone here, and this bone here is tooth-like appearance, and this is called odontoid process, or it is also referred to as dens or dens axis. Okay, so basically dens articulates with the fovea of the anterior arch of the atlas. Okay, so forming the atlantoaxial joint, and you have the rotational movement, like I said earlier. All right, and the other aspects, basically, they are similar. So we have the superior articular facet, and then we have the inferior articular facets. We have the body, we have the pedicle, lamina, and then we have the spinous process. Spinous process, as you can see, it's bifid. So the areas that we don't see bifid is C1 and C7, and the rest, C2, C3, C4, and C5 and C6 are bifid, spinous process. So this is C1 and C2 cervical vertebra. Okay, the other cervical vertebrae is, like I said, the rest is the same. You have the body, you have the pedicle on either side, you have the lamina, this is the vertebral arch, and you have the spinous process, and this is the bifid spinous process. You have the transverse process. In the transverse process, you have the transverse foramen. Passing through transverse foramen, it would be the vertebral artery vein and sympathetic plexus. And one of the things is that the answering process, you see, I don't know if you can see it, this slight slant towards upwards. You have like ears, okay, shaped structure. So this is called the answering process, and answering process is also a unique feature in the cervical vertebra. All right. And basically, that's about it. I think. Yeah, this is it for the vertebra of the vertebral column. All right. Let's look at now the sacrum now. Okay, this is the sacrum, as you can see. Okay, sacrum, like I said, it's the fusion of vertebrae. So you have a vertebra here, and you have another vertebra. So you have 1, 2, 3, 4, 5 vertebra, and it's basically fused. So in adults fused, but before that, these were just like other vertebra on the other levels, just like the other vertebrae. But these are fused here, and these are the fusion sites here. This is the anterior transverse line or ridges that represents the fusion point of each vertebra. So see, this is the anterior surface of the vertebra. Okay, so it's like triangular structure. We have the base, and you have the apex. So this part here is the base, apex. We have the ala on either side, the wings. All right, this is the wings, and then we have the anterior sacral foramina. Through these anterior sacral foramina passes the sacral nerves, and basically this area here is the true pelvis, which is direct in contact with the pelvic organs, so internal pelvic organs here. So that's about it on the anterior side. One of the other important things is the sacral promontory here. This thick and protrusion is sacral promontory. This is really important in terms of the radiological finding, where you can see this sacral promontory and count upwards and see what levels that you are at. Okay, on the lateral side, as you can see, this is the lateral side of the sacrum, which is the auricular surface. This is auricle. Auricle means the ear. All right, it looks like an ear, and it has this articular surface. This auricular surface contains this articular surface and articles with the ilium. They are the articular surface or articular facet of the ilium, forming the sacroiliac joint. So this is the lateral surface of the sacrum. If you look at the posterior aspect of the sacrum, what we see here is the superior articular facets on top, And in the midline, you have these bony protrusions which resemble the spinous processes, which are basically the spinous process, but the union of the vertebra. So this is the median sacral crest. So we call it the median sacral crest. And then we have the lateral sacral crest, just next to the posterior sacral foramen. So this is the posterior sacral foramen. Just next to it, you have the lateral sacral crest. And sometimes in some sources, we also have like the medial or intermediate sacral crest, which is this guy here. So median sacral crest is a remnant of this spinous process, and then we have the lateral sacral crest. It's a remnant of the lateral process, and the intermediate or the medial sacral crest is a remnant of the superior articular facets or superior the articular processes. Okay, and then at the bottom here, so we have this is sacral hiatus. Basically, the sacral hiatus is formed. There's no union at the fifth sacral vertebra. The spinous process and the lamina are not united here, and since they're not united, so you have this remaining opening area, which is called the sacral hiatus. And again, the sacral nerves passes through this area here. And that's about it of the sacrum. And then you have the coccyx located somewhere around here. Okay, that's sacrum. Let's look at the ribs now. Okay, so these are the ribs, all right? So, okay, so like I said, there's 12 ribs. First and second rib is a little bit different. Seems to be a little atypical. And then we have the 10, 11, 12 is also a little bit atypical rib. So what do we see in a normal rib? Let's look at it. So this is in a normal rib. The areas that we see here is the head, neck, and the tubercle, angle, and the body. Let's look at it again. So this area here, basically, how is it located? It's like, so this is, okay, so basically this is a thoracic vertebra, like I showed you earlier. Okay, thoracic vertebra. So you have the demifacets articulate with the head of the vertebra. So this is how it looks like. Okay, so this is the back part, and this is the lateral and front part, the ribs. All right. So basically, it articulates like this. So what we see here in the head, we have the superior and inferior articular facets here. So we have the superior and inferior articular facets. In between, there's a crest. I don't know if you can see it. So you have the superior and inferior articular facets. In between, there's a crest. All right. So basically, what happens is that superior articular facet of the rib articulates with the above demifacet. All right. And the inferior articular facet of the head of the rib articulates with the below demifacet. So it articulates with both demifacets of two vertebra, the body of the vertebra, like so. So we have, like I said, we have the superior articular facet, inferior articular facet. In between, we have the crest. So crest, the level of the crest basically is at the level of the intervertebral disc. So this is how it looks like here. So yeah, the crest between the superior and inferior articular facet, it's just on the intervertebral disc. It's just on this area here, intervertebral disc. All right. Okay, so this is the head, this is the neck, and this is the tubercle here. Now tubercle has two parts, articulating part and non-articulating part. So articulating part, as you can see, so this is smooth, this is articulating part, and then we have above is the non-articulating part. So basically this is called the tubercle. So the articulating part articulates with the costal surface of the transverse process of the vertebra, which is this. This is the costal surface of the transverse process of the vertebra. Basically, this smooth lower articulating, okay, the lower articulated surface, the lower articulated surface of the rib, all right, articulates with the costal surface of the transverse process. So basically, And the above rough part is basically the rough part is the attachment point for certain ligaments. So this is a tubercle, all right. This is a tubercle. So the lower part, the smooth part, is the articular surface. It articulates with the costal facet of the transverse process of the vertebra, all right. And the rest here is you have the angle. This is the angle where the bone basically curves around and curves towards the anterior aspect, and the rest is the body here. So this is the body. On the anterior side here is where this is the fovea, where the costal cartilage attaches, and through this costal cartilage and it attaches to the sternum. All right. So basically, this is the unique feature, common features of the rib. And all the ribs, as you can see here, you have the internal and external surfaces. So it's like external. This is the external surface, and this is the internal surface. All right. So this is the internal surface. This is the external surface of the rib. This is superior border, inferior border. Inferior border is sharp, as you can see. It's really sharp. And on the inferior medial side here, you have a groove, and this groove is called the costal groove. And costal groove, or sulcus costae, is important in that it lodges the intercostal structures like intercostal nerve, intercostal artery, and intercostal vein. Okay, VAN, vein, artery, and nerve, intercostal vein, intercostal artery, intercostal nerve, and this is called the costal groove or sulcus costae. Okay, this is located on the inferior medial aspect of the ribs. So, so this is a typical rib here, and if you look at the first rib, so this is the other ribs here. The first and second ribs. The first rib is really short, so this is the first rib. Again, in the first rib. Okay, so it's really short. Okay, let me look at it. Okay, it's really short. Okay, and in the on top of this rib, it contains the sulcus grooves for important vessels like subclavian artery and subclavian. So there's a tubercle here in the middle. Just behind that, you have the groove. This groove is for subclavian artery, and on the front, you have another groove. This groove is groove for subclavian vein, and you have attachment point for like scalenus anterior muscle. So you have the attachment point. You have the tubercle that attaches scalenus anterior muscle, and then you have the grooves for subclavian artery and subclavian vein. In between, you have the tubercle here. This is the tubercle. All right. And in the first two ribs, costa, you have the superior and inferior surfaces. As you can see, it's flat, and you have the superior surface, inferior surface. Is in the rest of the ribs, remember, we have the internal and the lateral surface. However, here we have the superior, inferior. And second rib is like that too. This is second rib. All right. We have we have the head, neck, and the tubercles. And we have the tuberosity here, or tubercle, or tuberosity. This tuberosity is for the anterior serratus anterior muscle that attaches here. Okay, this is the flat, again, superior surface, inferior surface. This is the second rib. Okay. Again, we have the superior and inferior articular facets in the head, the neck, and the tubercle here, angle, and this is the body. Okay, so this is the ribs. Okay, that's it about the ribs. Let's look at the last thing is the sternum. All right, so this is the sternum. This is the mandibular sternum, the body of the sternum, and this is the xiphoid process. All right, and this is the mandibular sternal angle and xipho-sternal angle here. So mandibular sternal angle. This is sternal angle, by the way. Okay, mandibular sternal joint. Sorry, this is the mandibular sternal joint. This is a sternal angle because there's a small. If you feel it in your own sternum, there's a small like protrusion or elevation of bone, and this is called the sternal angle. And this is the xipho-sternal joint here. the union between the xiphopress and the body. This is the suprasternal angle. It is also referred to as a sternal jugular notch or suprasternal angle. I'm sorry, suprasternal notch or jugular notch. Just next to it, you have the clavicular notch. Okay, so we have this jugular notch or suprasternal notch, and then we have the clavicular notch on either side. So the clavicle touch, the left clavicle touches here, and the other clavicle touches here, and this is the jugular notch or suprasternal notch. The others are attachment points for the costal cartilage of the ribs, of the costa of the ribs. So we have this first, second, third, fourth, fifth, sixth, seventh. So we have 7 attachment points on the sternum of the costal cartilages of the ribs. 7 attachment points. Don't forget that. So where's the others? So we have the 8, 9, 10 unites with the 7th, and that's how it attaches to the sternum. However, the 11th and 12th are floating ribs, and they don't have any attachment points on the entry aspect. Okay, this is the sternum, by the way. And I think that's about it. Okay. Okay, thank you very much for listening. I think we covered a lot of things here today. The vertebral column, the ribs, and the sternum. And that's about it, I think. And if you have any questions, and I'll be around. Thank you very much for today. And thank you for listening. And bye-bye for now. Bye.